Hello and welcome to this special edition of Creighton in the Community. Today we're going on the road. We're going to visit 3 of the 6 Creighton University Medical Associates clinics. We're going to learn about primary care physicians. Sometimes they're called internists, sometimes they're called family practice. But most importantly, we're going to learn why everyone should have one. Welcome to the Dundee Clinic on Underwood Avenue, located in Midtown Omaha. Today I'm with Dr. Shalini Pachala. She's an internal medicine physician. Hello. Now I noticed that you are an internal medicine. Tell me exactly what an internist is.
Internist is somebody who is trained through accredited internal medicine residency training, but that for the common man, it means that we are trained to take care of the chronic medical conditions like high blood pressure, diabetes, high cholesterol, heart issues, and we're more trained to take care of the patient as a whole and not just related to one particular condition or not. But the more diagnoses you have, the more complex you get, and it always makes better sense to see an internist if you have more chronic medical conditions that you have to have taken care of.
Why do you believe that people need to have a primary health care physician?
I can think of 3 reasons. Everybody needs periodic, I'm not going to say annual, but periodic checkups to make sure that they're in good health and that they don't have any things which are going on with them but which would not have any symptoms. So periodic checkups is one reason, and as in specific to each age group or gender, you have to look out for conditions which people then generally do not have symptoms for and catch cancers, things like cancers.
What are some things like at midlife that you would be looking for that would be indicators of a future problem?
Any change in your habits, like you might not think much about it, but just a subtle change in your bowel habits might be an indication or that you need screening for colon cancer, or you might have a family history. And if you're not aware that family history is important, then your primary care physician will be the person to catch that and do the necessary screening. So that's what I'm talking about when I say catching things before they actually happen. And also the primary care physicians take care of the minor illnesses that come day to day, like your routine coughs, your colds, your influenzas, your strep throats. The primary care physician takes care of that. No specialist will be happy dealing with that kind of stuff. And if you have a complex medical history and you see a lot of specialists, then the primary care physician acts as a mediator or the common link between all the specialists so that your care can be appropriately managed.
I'm going to make this personal to me. I am in my mid-50s. At what point should I move away perhaps from my gynecologist and consider seeing you, who's an internist?
If you do not have any major gynecological issues like cervical cancer, or you've been treated and that has been treated and taken care of, if you don't have anything actively that the gynecologist is doing, then if you just need periodic checkups like annual PAPs or annual checkups, then as a primary care physician, I will take care of that. So you should be able to stop seeing your gynecologist. Even things like hormone replacement therapy, those are managed by primary care physicians.
How do I go about choosing the best primary care or internist for me?
The main thing, always talk to people you know and you trust. The first thing I go is by my family and friends' recommendations, and then when you do, it's always the good idea to shop around. It's not a bad thing, because you need to know, you need to develop a rapport with this person for a long time, and you want to know that this physician would understand you, and you should be able to have the most embarrassing conversation with them when it comes to your health. Then talk to your family and friends, go to the reputed hospitals in the city, and That's how I would usually recommend.
That's interesting that you said that. It's something I hadn't thought of, that you would choose a primary care physician that is connected into a health system, which is a really good thing about the Creighton Medical Associates being located into the Creighton Medical Hospital. That's a really good point. I suppose young women think about that when they have their babies, is where they have it. When you get to my age, you don't really think about that. How do you know that that physician is reputable?
There are websites. I mean, I wouldn't generally say the internet, but you have to look for the board certification status is something you can look for a physician, if they're board certified and if it's current or not. They can look that up on abim.org. This is specific for internal medicine, and each specialty would have its own board site, which they can be referred to, and they can look up their certification status. And again, history of the institution, like Creighton, and talking to people.
Do you ever see children in your practice?
As an internist, no.
So what age do you start seeing?
18 and above.
18, so that's when you traditionally leave the pediatrician and go into the next. What if I am seeing you and you discover I have a problem, that you suspect a cancer or something? Then how do you work with a specialist? Do you refer me? How does that work?
We can do referrals. Now with the electronic health records, it's more organized. It goes to a particular office where it will be taken care of.
You think I might have a problem and I need to see an oncologist, then you would walk me through that process?
We will set up the appointment, we will gather all the information that is needed, provide that information to the specialist, and also obtain correspondence from them about what they recommend, and work with you on organizing the tests or procedures, whatever needed.
Do I return back to you, and are you with me on this journey? I mean, once let's say I have a cancer diagnosis and I'm seeing an oncologist, you stay with me the whole time?
Absolutely. That's what I meant when I said I'm the mediator between all the specialists, so I'm the common link.
Thank you. Next stop, Twin Creeks Clinic in Bellevue, Nebraska. Choosing a primary care physician is only part of the equation. Choosing a clinic where you're comfortable also is very important. We are here in Bellevue at the Twin Creeks Clinic, and I'm with Dr. John Burhan. Dr. Burhan, you are a family practice physician. We just visited an internist, yet you're both primary care physicians. Can you help me understand that?
Family medicine, we see all age groups. We see everybody from who are young kids from the time that they're born, follow them through as they're toddlers, see them as teenagers. We see adult patients. We also see the elderly. We deal a lot with a lot of geriatric populations. A lot of our geriatric patients have special needs and special circumstances that we help provide appropriate medical care. And also we deal with women who are pregnant. We will manage their pregnancy throughout their whole pregnancy, and also deliver the babies as well.
Well, then I'm going to ask the hard question. If you, which obviously I will never be again, but if you choose to be pregnant, why wouldn't you go to an obstetrician? Why would you elect to come to a family practice?
You can absolutely have the choice to go to an obstetrician, but we are trained as well to take care of patients who are pregnant as well. Of course, sometimes certain pregnant patients will have special needs that we will seek the advice and assistance of the obstetricians, but we provide the same quality of care as the obstetrician does as well.
Well, then I'm going to ask the hard question. If you, which obviously I will never be again, but if you choose to be pregnant, why wouldn't you go to an obstetrician?
You can absolutely have the choice to go to an obstetrician, but we are trained as well to take care of patients who are pregnant as well. Of course, sometimes certain pregnant patients will have special needs that we will seek the advice and assistance of the obstetricians, but we provide the same quality of care as the obstetrician does as well.
So you start with the pregnant mom. Do you deliver the baby?
Absolutely.
Absolutely. And then well, you are full service.
Yes, from the time we We monitor the pregnancy, then as soon as the baby is delivered, at that point I also become the pediatrician, and we continue the care from that point as well.
At what point do you call in a specialist?
There's a lot of things that we are trained to do. As I said before, sometimes there will be a certain medical procedure that needs to be done, that there's a lot of specialists who are very well trained in this, that we will seek their assistance. Sometimes if the cases become a little complicated and we're not too comfortable taking care of that patient, we will seek assistance and help co-manage that patient with the specialist as well. So at the same time, we know we're very, very capable of handling many situations, but sometimes we know our limits as well too, and that's at a time with the patient and myself. When we discuss the situation, we will decide together that I think it's time to see a specialist, and we will proceed accordingly.
Why did you elect to be a family practice physician?
From the first day of medical school, to be honest with you, I knew what I wanted to do. Prior to starting medical school, I used to work at the local hospitals here, and I got to see many of the different physicians and their disciplines of what they do and they don't do. It's kind of like that old show, they used to ask you what's behind door number 1, 2, and 3, and that's what I love about it. I never know what's going on until I open that door. And that is just a fascinating thing for me to deal with. And I love dealing with all kind of issues, and I'm very privileged to do that.
What advice do you give people when selecting a clinic that is best for their family?
You need to choose a clinic that you're going to be very comfortable with. You're going to be working with a team that works very closely with you, starting from the receptionist to the MAs to the doctor. It is very important that you choose a clinic where you're going to be very comfortable not only with the medical staff, but the medical team, and you've developed a good working relationship with.
There's been a lot of discussion, both on the state level and the national level, about an individual's need for a medical home. Would you call your clinic a medical home?
Absolutely, in every way, shape, or form. We have wonderful people that work here, very caring people, very dedicated people, very hardworking people. Once we start getting, after first 1 or 2 visits, we're on a first name basis. The minute you walk in through the door, they will know you by your name, greet you. Around this clinic, we have a lot of hugs all over the place when we see our patients. And that's very important to develop that relationship and that rapport, which actually enhances quality care. Developing that medical home is very important. Other factors, location. Location is very important. Here at Twins Creek, for example, we're located in, around major streets, very easily accessible. Also, we do understand that patients sometimes it's difficult for them to take time off during regular work days to come and see us. Here at Twins Creek, we're open 3 nights a week till 7 o'clock at night, and also Saturdays from 9 to 12 as well. So we like to accommodate people in that way as well. And more specifically here at Twins Creek, we have a lot of the multi-specialties that come once or twice a week. We have a wonderful physical therapy department upstairs that we have a great working relationship with. And so not only will you see me, as we were saying earlier, that sometimes we'll refer to specialists, you don't have to go to a different site. We can be seen at the Twins Creek Clinic with whatever needs you may have.
What are the demographics of your clinic?
There's a wonderful diverse patient population here. As you well know, being in Bellevue, the Offutt Air Force Base is here, so we deal with a lot of the military families. And they're a wonderful group of people. Again, we see everybody from kids to adults to the elderly and women who are pregnant.
What are some examples of preventative care?
I am very big on preventative care. If I can prevent you from getting diabetes, high blood pressure, heart disease, asthma, obesity, I have done my job. There's only a certain amount of things that I can do. A patient-doctor relationship, there's only certain things that a doctor can do, and then there's a point where the patient needs to do their job as well too. I will constantly be on you to come visit me once a year. We would do appropriate medical tests and always try to motivate you to do the right things. So it's very important that not only the doctor takes care of the medical aspect of things, but for the patient to follow the do's and don'ts of what the doctor asks of you.
That really makes sense. If they're comfortable with you and comfortable with coming here, they'll be more inclined to do that.
Yes, that's correct.
Creighton University is a teaching hospital.
Yes.
Do you have residents that are working with you?
Absolutely. I have medical students. I have residents that come and rotate here with me. They'll spend 1-2 months at a time with me here. We take great pride in training the future physicians, if you will. And especially from the medical students, they have a great time having a one-on-one working relationship with the preceptor, get hands-on experience, as well as the residents, making them comfortable with medical management and procedures to get them ready for when they're out in the real world, when it comes time for that.
What is the advantage to have a student involved in your practice?
Actually, when the student comes here, from day one, we put them as part of the team. They're a very great asset to us because they spend more time with the patient than what I would do. They ask great questions and they ask more questions. And when they come out and present to me, it actually helps me develop a better diagnosis and treatment plan. And so they're very well receptive, and we enjoy having them around here.
Thank you very much. And now we head to the Old Market. Our last stop is Creighton's Old Market Clinic, and I'm here with Dr. Allison Cullen. Now, Dr. Cullen, I understand you are a family practice physician, but you also have a specialty in sports. Tell me a little bit about that combination.
I enjoy primary care sports medicine, which is the non-operative treatment of musculoskeletal injuries in both competitive and recreational athletes of all ages. So it starts with pre-participation sports physicals to determine if someone is eligible to participate in sports or if they have any particular risk factors that should be considered prior to participation. Counseling regarding injury and illness prevention, concussions, illnesses specific to female athletes. It also involves return to play issues. If you have an injured or an ill athlete, when are they safe to go back?
I'd like to talk a little bit about this. I'm a mother of 2 athletes, and so I went through many of those physicals. What are some things that I should have looked at as a mother?
Well, usually we ask if there's a family history of sudden cardiac death in young people. You may have heard some popular things in the news when competitive athletes are suddenly drop dead, and that's often due to a heart condition. So that's something that we screen for, just looking for heart murmurs and taking the family history, as well as any other past history of any injuries. We'll do a detailed exam of those body areas to make sure that the child is healed appropriately and they're safe to return to play.
So with our little ones that we put out there to play soccer at 5, they should have gone to their pediatrician or to their general practitioner before that to make sure that they should play. Many people don't do that, I believe.
It's usually a good idea.
Let's talk about the next step. Then now they're playing. They get hurt while they're in sports. Then they come to you, and you mentioned counseling. Tell me about that.
Well, part of it is how to avoid injuries in the first place, whether it's with the appropriate equipment, appropriate training. We also do, we diagnose the injuries through physical exams and possibly imaging studies. And there's many ways of treating those conditions. Some involve physical therapy, medications. Otherwise, if we feel the patient needs to be seen by an orthopedic surgeon, then we plug them into those services as well.
You're primarily a family medicine physician, but you have that specialty in sports. Is that an added bonus then to the patients that come to see you, or how did you come about to get that extra certification?
Just an area where I developed special interest. So I spent a couple of months doing some extra electives in my residency training to get some extra experience in that area. And I volunteered at various mass participation sports events, like the Phoenix Rock and Roll Half Marathon. I worked as a medical captain in the medical tent there. The Phoenix, what they call the FBR Open Golf Tournament, dealing with injuries for mostly spectators, not so much the golfers there.
Are you an athlete yourself?
I am. Yep, I enjoy running. I've completed 2 marathons and enjoy cycling.
Do you have clients that then come to you just because you have that expertise in sports medicine?
Certainly our patients that we see for all of their medical needs come to us for their musculoskeletal injuries as well. But we also have patients who are not our regular patients, who just come for their musculoskeletal injuries.
Tell me about your patients. What are the demographics of your patients?
Well, the Old Market Clinic, it's a very diverse group of patients. There's a lot of new lofts and condominiums around here, so we see many residents of the Old Market and immediately surrounding area, as well as a number of executives and other people that work in the Old Market area. They find it convenient to attend their medical appointments during the day. We also see a lot of Creighton students as well as their families.
Are there many children do you see many children in the Old Market area?
We see some children, but we see the whole mix, anyone from newborns to elderly.
If I would come to see you, what would you want me to bring with me on my first visit?
A list of questions, because far too often we get into the appointment and someone says, I knew there was something else that I wanted to ask you, and just can't think of what that question is.
So it's okay to write them down.
It's really helpful if you have them written down, because then we can get them all out up front, and that helps us to prioritize and know what the most important issues are, so that we don't spend all of our time on one thing and miss the most important thing, which was actually question number 6.
What are the important numbers that we should know as a person about our health? I know that the obvious one probably is my blood pressure, but what are some other things that I should know about myself?
Well, as far as risk factors for cardiovascular disease and diabetes, blood pressure, cholesterol, body mass index, which is a measurement based on height and weight, those are all important numbers to know.
What makes a Creighton physician unique?
Creighton physicians are unique because they're involved in academics, which is teaching the doctors of tomorrow. So I think that's a commitment to stay on top of the most current advances in medicine, to teach our residents and medical students, which is also beneficial to our patients as well.
Thank you. We hope that when you are searching for a clinic, a medical home of sorts, or a primary care physician, you'll consider Creighton. On behalf of all of us, thanks for watching.